Welcome, everyone. We'll give just about one more minute till we get started so that everyone can join and log into the Zoom session. But welcome to the Firefighter Cancer Initiative Seminar Series. Great. Well, again, thank you so much for joining us this Tuesday afternoon. Today with the Firefighter Cancer Initiative Seminar Series, we are going to be hearing two presentations. First, our presenter is Dr. Barbara Millet with the University of Miami and the School of Communications, and she'll be presenting about the Personal Exposure Reporter. And then after that, we're going to be having Eli Nodarse, who will be presenting on our dashboards for our Firefighter Cancer Initiative research initiatives, the annual cancer survey, the aerial study, and then the data from the PER, the Personal Exposure Reporter. So as I said, thank you very much for joining us and welcome to the Firefighter Cancer Initiative Seminar Series. This two-part series will begin with Dr. Barbara Millet, and then we will have Eli Nodarse presenting the FCI data dashboards. A couple housekeeping items. If you see in your presentation the Q&A function at the bottom of the screen, if you have any questions throughout the presentations, please do type your questions in the Q&A function. All of the presenters will be able to see that. We will hold questions till the end of each presenter's portion, and then we'll be able to answer them. So like I said, at any time, please type your questions in the Q&A function, and we will get to them after the presenters finish. Okay. Thank you. Well, with that, Dr. Millet, if you'd like to begin.
As Dr. Millet gets started, I just wanted to mention just a few words really quickly about our presenters today. So good afternoon, everyone. My name is Alberto Caban Martinez. I'm the Deputy Director of the Firefighter Cancer Initiative. I did want to just say a couple of words about this really important project that Dr. Millet is going to be presenting on in the next couple of minutes. So the PER is actually a project that originated by the request of firefighters. And it's such a really neat project because we often say, and as Dr. Kovitz would say, everything that happens in the Firefighter Cancer Initiative is driven by the needs of our firefighters. And early on in the Firefighter Cancer Initiative back in 2015 now, almost 7 years, the request by our firefighters was to develop a mechanism to record their personal exposures. So independent of wherever they may go in their career as a firefighter, say in the state of Florida, moving from one fire department to another, the PER gives them the space and the tools to be able to record this exposure. And so the FCI leadership is incredibly thankful to Dr. Millet and her team for spending so much time with firefighters to document meticulously all the variables that need to be collected about an individual exposure. And so from that request, almost 7 years now, we have the birth of the Personal Exposure Record app. So we're really proud to showcase not only the app, but also Dr. Millet's work through this process. So thank you, Dr. Millet. I'll turn it over to you.
Thank you so much. Good afternoon. My name is Barbara Millet. My research investigates interactions between users and technologies with the goal of designing products that improve human performance in safety critical settings. Today, I'm going to be presenting on how user-centered design informed the PER's system development, implementation, and about its efficacy. University of Miami and the state of Florida collaborated with Florida fire departments to better understand the risk firefighters are exposed to and how those risks can be reduced. Through this collaboration, the Personal Exposure Reporter was developed. The reporting system collects information about potentially harmful incidents in the fire service, giving firefighters greater level of awareness of their health and wellness, and supporting research efforts aimed at cancer prevention and treatment. The primary function of the exposure reporting system is the completion of exposure reports. One of the main goals for this project was to identify and validate reporting variables for exposure events across incident types. So fire, hazmat, water rescue, investigations, fire training. In order for us to explore ways in which information about exposure events is structured in the firefighter's memory, we needed, and we wanted to do this in order to be able to better support memory recall. We use cognitive research techniques, namely the mental models approach, which involves sorting tasks and cognitive interviews. The research also examined user needs and information processing styles to determine the most appropriate content and content order for the exposure reports. Although we designed the reporting instrument for firefighters, the collected data also needs to be sufficient for research. So we needed to ensure that the data collected could be used by cancer researchers to identify occupational risk. The research to inform the system design was carried out in multiple phases following the user-centered design framework. We conducted generative research to identify report variables and inform the design of the exposure reporting system, and conducted evaluative research iteratively to assess the usability of the developed system prior to and after product launch. Overall, we had 450 firefighters from 8 South Florida fire agencies participate across the research activities. We followed a 5-step process in informing the design of the report variables and system. 1, we worked with an expert panel to identify a preliminary variable set. We conducted focus groups with target users. We conducted interviews and card sorts with firefighters and researchers, and we then developed and tested the report variables and the system design. The initial variable set, which is presented here, was derived from an expert panel consisting of 3 high-ranking officers and 3 cancer researchers. They all had more than 20 years of experience in their respective fields. The researchers in particular had experience with occupational exposures, and one had previously conducted research on cancer risk for firefighters. This preliminary effort resulted in a paper-based report with 68 items categorized into 13 groups, organized mostly by semantic similarity. On the positive side, the set included variables focused on health outcomes, and this differed from the existing exposure reports that were available at the time. The downside, the form was long. Some of the questions were poorly organized given space constraints of trying to fit it into one page, and some questions used ambiguous language. Next, we conducted focus groups to investigate potential risk of job exposures and to identify broad-based concerns regarding work and health. We ran sessions until saturation was reached, which resulted in about 3 to 5 focus groups for each report type, with 3 to 15 firefighters in each session. What we found is that firefighters understood that a higher than normal cancer incidence was an unavoidable risk with their profession. They were not averse to risk mitigation, but they felt those types of efforts were often overburdened by barriers beyond their control. They worried that personal exposure reporting would add too much time and effort to their workload. They had concerns about who would get access to the data they reported. Firefighters didn't believe that a one-size-fits-all approach would work across different incident types involving different procedures, gears, exposures, and hazards. And lastly, they believed that since exposure reporting would need to be done on the go, they would need to be able to use their own personal devices. We use card sorting to identify exposure schemas of firefighters and to explore the ways in which this group arranged exposure information into categories, how they justified their arrangements, and what they named their categories. Additionally, we conducted interviews during the card sorting session to identify sources of response error and to explore information presentation priorities. We used graph visualization to explore and understand the card sort data, focusing on visualizing the relationship between cards. Here, I'm showing you the card sort co-occurrence data for firefighters. This analysis relies on co-occurrence data, and it allows us to see common relationships between cards, regardless of different mental sorting strategies. And we use that to help us develop the report in terms of what variables go first, what's following it, what cards are grouped together. We found that firefighters organize event-based information following a chronological pattern by arranging information according to representations of a particular time. Their organizational strategy was to divide topics to before, during, after segments. Category labels generally represented phases of work from the incident call through activities on the scene to decontamination procedures on a scene and at the station. Firefighters felt that answering questions about compliance to standard operating procedures may provoke punitive actions. Questions about their personal lives, like alcohol consumption, marital status, were seen unlikely to provide information related to cancer risk. Most firefighters were uncomfortable providing their social security numbers, even the last 2 digits. And we were trying to capture this information only to cross-reference records with the National Cancer Registry. But in the end, given the firefighters' objection, we did not include it in the PER. We conducted user testing, both formative and summative, across evaluations. Firefighter participants completed a reporting test task using the Personal Exposure Reporter. 4 categories of usability metrics were collected: efficiency, effectiveness, perceived usability, and usability improvement opportunities. For each task, the mean time on task was less than 10 minutes. Most participants indicated that completing the exposure report took less time than they had anticipated, which was a good thing. Participants completed all tasks at 80% or greater success rates, and the overall system usability score, which is a metric that we use to capture perceived usability, was 88% and in the direction of favorable perceived usability. This test provided helpful insights for addressing issues with question wording, incomplete response item sets, questions that led to unreliable answers, and inappropriate control types for specific responses. Through our research activities, we identified all the reporting variables. From these variables, the profile form and exposure reports were created. Currently, there are 6 exposure reports: fire incident, fire investigation, fire training, hazardous materials, water rescue, and COVID-19. Each report has fewer than 35 questions. All reports measure firefighter knowledge and behavior at the incident level, with specific focus on categorizing the incident, describing scene conditions, what gear was worn, and decontamination practices, as well as capturing occupational exposures and medical symptoms experienced. The application stores identifiable data collected in a separate REDCap database, so that way we can ensure that our system is safe and protects the user's data. So I'm going to now show you the system. Okay, so this is what the personal exposure system looks like. Once you log in, you will have access to these 4 different views. The dashboard presents information specific for the firefighter unless they change the view type. Here you'd be able to change your view type. But generally, these 2 data elements are specific for the firefighter who's logged into the system. We then have the profile view, which could be updated at any time. It's usually completed when you first sign up to use the system. And you'll notice that in the bottom, we have a contact information request. Basically, it asks if the end user, the user of the system would like to be contacted by a cancer researcher. And if the user indicates yes, that'll be the only way that a cancer researcher will reach out for additional information. We have view reports, which keeps a log of all the reports that have been entered into the system. And then lastly, we have the create report view. And in this view, you can select among the different reports that are available in the system. And then the form dynamically adjusts based on the report that you've selected. Okay. To date, 1,955 users have signed up. PER has expanded organically to other areas across the country, being sought out and used by individuals and agencies outside of Florida. The system on its own has reached past its intended user group, which was the Florida firefighters, and it's now representing 215 departments across the country. Extending well beyond our target user groups broadens the impact of the data that we collect by allowing the exploration of exposures across regions. Users have initiated 1,666 reports. The success of an exposure report system depends on respondents' willingness to both report and provide fully completed reports. In the case of the PER, most of the reports have been at least 80% complete. Firefighters are submitting reports at a high completion rate, suggesting promising and efficacious data capture. The system is available online at per.miami.edu. It's also available as an app that you can get on Google Play and at the Apple App Store. Special thanks to Palm Beach County Fire Rescue, Broward Sheriff's Office, Miami-Dade Fire Rescue, Delray Beach Fire Rescue, Davie Fire Rescue, City of Hollywood, Coral Springs Parkland Fire Department, and Florida State Fire Marshal. Thank you so much.
Thank you so much, Dr. Millet, for that awesome presentation. Perhaps, Cynthia, can we entertain questions at this time, or would you prefer that we move on to our next presenter?
We can, and actually we just received a question from the Q&A. Dr. Millet, would you like to read it, or would you like me to moderate?
I can read it.
Okay, great.
Okay, it says, in Washington State, we have a similar reporting system, an app for your phone, and an app for your phone. How can the Washington State Council of Firefighters help with the data already collected and to refine the information asked of the members to support your research? And he references here peers.org, which is terrific. We've actually have reviewed your system as well. It's incredibly well done. We would love an opportunity to partner with you and look at ways that we can compare our data and contribute to consistency of the variables across the systems. Dr. Caban, do you want to chime in on this?
Yeah, so I think there's a couple of different routes and pathways. Originally, when we were funded by the state of Florida, one of the requests of the firefighters was explicitly to create this PER system, and there was sort of a needs assessment and an environmental scan to evaluate what was out there, both in the private sector and in the public sector. And I say we, really it's Dr. Millet and her team that put together these particular reports based on what firefighters were telling us that were needed. And I think as a formative step in terms of comparing exposures, being able to partner with other apps that are also recording individual personalized exposures is really important and really critical, because we realize that there's geographic variations in the types of exposures that firefighters experience, not only by sheer virtue of their tasks, right? Like the type of firefighter that you are, if you're wildland, a fire investigator, a structural firefighter, but also just by the geography. You know, a house here in Florida is not the same as a house in, Washington State or as in New York. And so it's really important to be able to compare these exposures within and across these firefighters. So we'd be happy to collaborate with our colleagues in Washington State and the peer system to look at how that data can be compared across and, sort of set that up. So thank you for bringing that up.
Yeah, it's terrific. I'm going to send you my email address. I would love it if you would reach out so we can schedule some time to discuss for next steps. And thank you very much for your question.
Do we have any other questions from our attendees virtually, either through the chat or in person? Don't be shy. Feel free to unmute and ask your question. Okay. I guess you did a really robust job there explaining the whole entire PER app. So if you're shy, please do reach out to Dr. Millet. I think she'll post her email address on the chat so you can directly communicate with her for any of those that are interested or have questions or concerns about the app.
And also I'm sorry, before we move on, for system users, firefighters that are currently using the system, we've had different fire agencies reach out to us to make specific changes that are better suited for their organization, and we welcome those requests. So don't hesitate to reach out if there's something else that you would like to have captured, or if there's a change that you would want to see, just reach out and we're happy to make those changes. And thank you for your suggestions.
Yeah, that's an excellent point. Like Dr. Millet and her team really do a wonderful job at contouring and tailoring a lot of the reporting as we realize there's variation within fire department or across fire departments of how they record their incident response. So she is flexible and always open to suggestions.
Wonderful.
Okay, so sorry, Cynthia, go ahead.
No, that's it. So if you do have questions about PER that do come up, please add them to the chat. After Eli's presentation, we'll be able to open it up to all of our speakers for questions. So you didn't miss your chance yet. Our next presenter is going to be Eli Nodarse presenting the FCI study dashboards. Dr. Caban, would you like to speak briefly, or Dr. Saleh, about the ACS and the aerial studies? Again, PER is also included in what Eli will be presenting, which Dr. Millet just presented.
Indeed, thank you, Cynthia. So as Eli cues up his presentation, let me just say we're really thankful to Dr. Kovitz and to Eli for sort of instigating this opportunity to do this. Again, this was another project that came from requests from firefighters to be able to peer in and get sort of a high-level overview of the data that we've been collecting across our cohort projects. So the Firefighter Cancer Initiative, since its inception back in 2015, initiated 2 cohorts. The first one is the annual cancer survey, which is an annual survey completed by our Florida firefighters for those that are working or incumbent within the fire service. And a year right after, in 2016, Dr. Saleh and I launched the aerial cohort study, which, if you ask me to spell out the name right now, I won't remember it off the top of my head, but it's the cohort that's dedicated to our retired Florida firefighters who asked us to also document their cancer experience through the retirement and drop zone process. So together, the ACS, the aerial, and the PER projects have been a new focus of ours to develop a dashboard to be able to give firefighters and other stakeholder groups an ability to peer into the experience of our firefighters as they report into the annual cancer survey, aerial, and into PER. So I'll turn it over to my colleague, Eli Nodarse, to sort of explain where we're at with this process. Dr. Saleh, are there any words you'd like to mention before he gets started?
No, I think you've covered everything. I don't want to take any of his time.
Okay, thank you. All right, Eli, floor is yours.
All right, thank you, everyone. Hi, everyone. My name is Eli Nodarse. For those who don't know me, I'm a biostatistician programmer at the University of Miami. I work for the Sylvester Cancer Center under Dr. Erin Kovitz, and I'll be showing you some dashboards that hopefully you'll like as well. Okay, so let me go ahead and share my screen. Okay. Can everyone see my screen?
Yes.
Yes.
Okay, awesome. Okay, so this is the FCI dashboard that I've been working on. So the dashboard has 3 main surveys. So we have the annual cancer survey. We have the advanced epidemiology of retired firefighters aging longitudinally, and the personal exposure survey. So in this dashboard, we show some information about the participants in the surveys. So some of the social demographic information that we have is the gender. We also have the age groups, which we bucketed into different subgroups. We have the race and ethnicity. Each of these plots were made in a programming language called R. Some of you might have heard it. Some of the most common packages that I've been using in this dashboard are the Shiny package, the Shiny Dashboards, Plotly, and Tidyverse. If you have any questions about any of those packages, feel free to contact me after the presentation. And the good thing about this plot is that they're interactive. So as you scroll through them or hover over, you're gonna see extra information on each of them. I've also added a summary table on each of these categories that we're presenting on the dashboard. And the plots are shown in percentage form and the tables are shown in totals. So you might see also in some of the plots that there's a not reported section. That means that the question was left blank by a participant in the survey. And then if you see the filtered in parentheses less than 10, that means that they were less than 10 participants in a specific subgroup. So for privacy information, we just bucket it into a filtered section. So aside from the social demographics, we also have some extra information like the education level of the participants, also the marital status, and finally the insurance type, the type of health insurance for the participants. Another piece of information that will be added soon to the ACS and aerial survey are the cancer information. So the cancer type and the cancer status of the participants. The area survey has the exact same information as the American, as the annual cancer survey. So we have the social demographic information, the gender, age group, race and ethnicity, and then also the education, medical status, and the insurance information. As for the per survey, we have similar information. So we have the social demographics again, the gender, age group, race, and ethnicity. And then we also have already on this one, the cancer status information, as well as the cancer type information. So the cancer type section is only showing the participants who answered yes to the cancer status question. So this plot over here will only show the participants who said that they do have cancer. Okay, so that's it for this dashboard. So again, all of the plots, all of the categories have their plots and their respective tables with information. And now I'm going to show you the FFCCS dashboard, which is for the firefighter cancer cohort study. So the dashboard is inserted into an iframe into the ffccs.org website, and it's right here under the dashboard section. So this dashboard is composed of two main parts. So we have the firefighter characteristics, and then we also have the social demographics section in the dashboard. As for the firefighter characteristics, we have some information like the location of the participants. We also have the ranks of the participants, the experience in years, as well as the career versus volunteer pie chart. Starting with the location tab, so this information can be either shown in FEMA subgroups or state subgroups. So you can select and toggle between them, and the table will interact accordingly. And this map over here, each of the different colors represents a different FEMA region. And then of course we have the states. As you hover over, you're going to notice that some new information pops up. So for example, for the state of Florida, it belongs to the FEMA region number 4, and there were 238 participants in the state of Florida for this survey. The ranks, of course, we have the plot as well as the table, and the same thing follows for the experience level as well as the career versus volunteer. So each of the categories has their plot as well as their respective table. As for the social demographic section, again, we have the gender pie chart followed by the table. Again, all of the plots are in percentage form and all of the tables are in total form. And then the race and ethnicity. So this one has two plots. We have the pie chart showing the ethnicity distribution, and then the graph showing the race distribution. And then it's followed by the table, which shows the race totals. And then for the age groups, we selected some different buckets that will show distribution for the age, and then it's followed by the table as well. And then in this dashboard, if you were to have any questions, you would just click over here and it'll show you where to contact in case you see anything that you find interesting or you have any questions on the dashboard. You can go ahead and send an email to that email address. So that's it for the dashboard. So let me go ahead and stop sharing. Again, if anyone has any questions on the tools that I use to create the dashboards, feel free to ask me any questions on it. And thank you for your time.
Thank you so much, Eli. One thing that I would like to note, Eli presented the FFCCS that is currently embedded in the website. So the first dashboards, the FCI projects, the ACS, Aerial, and PER are still in the formative stage. So those dashboards will be put on the Sylvester website, sylvester.org/firefighters, in an iframe very similar. So it's a work in progress is the point for those FCI dashboards. It will look similar to the FFCCS. Once it's completed, it's one of our deliverables for the year. So we're very excited on the progress that we've been making towards that. So the one footnote.
Any questions or comments from our participants online, either through the chat or you can feel free to unmute yourself. Okay, doesn't appear we have any additional questions for today, Cynthia.
I don't see any in the chat for now.
Okay.
If anyone does have any questions, please feel free to reach out to us. If you email firefighterstudy@miami.edu, we can direct your questions accordingly to any of our investigators, or as Dr. Millet said, and please feel free to reach out to her as well. The presentations that we had today are very much, central to the mission of FCI, and the PER, as Dr. Millet said, is something that's ever evolving, and it's very important to us to continue to be responsive to our firefighter partners and the dashboards that Eli's been working on for the various studies. We are very excited to be able to publish soon, and in a similar fashion to continue to evolve the project to meet the needs of our constituents, as with all of our FCI projects. So we want to say thank you so much for joining us and for participating. Just a reminder that this presentation was recorded. It will be posted on our Sylvester Comprehensive Cancer Center YouTube channel under our FCI playlist. As with all of our presentations, our seminars from this series, this will be posted and available to anyone online. So please feel free to forward it and let us know if you have any questions. I want to say thank you so much again for joining us, and we look forward to seeing you next month. And just another quick footnote, the National Firefighter Cancer Symposium will be held in June 10th through 12th, and we will be sending out information regarding registration later this week. We're very excited about it. So please stay tuned for that and for the registration links for the symposium. And if there's nothing else. Okay, great. Well, thank you very much and have a wonderful afternoon.
Thank you.